Welcome back to the deep dive. Okay, so you've asked us to take a close look at something that's definitely been on, well, a lot of minds lately. The current landscape of COVID-19 here in 2025. Our goal today is pretty straightforward. Really dig into the latest on COVID. We're talking new symptoms, emerging variants, and what it all means for you. And this is all based directly on those sources you shared with us.
Yeah, absolutely.
And, among those sources, one symptom really jumped out. It's being called razor blade throat.
Oh, yeah.
It immediately makes you curious, right? Like, what exactly is behind that description?
It absolutely does. And, that curiosity is exactly why this deep dive feels so timely right now. In a world where health information just keeps changing almost constantly, maintaining an informed understanding, it's more important than ever.
Totally.
So we're here to help you sort of navigate this evolving picture, give you some clarity, get beyond just the headlines to what's really going on.
Absolutely. And to bring that clarity, let's start by introducing the new players, right? The variants that are currently shaping the COVID picture in the U.S. This is as of 2025.
Okay.
First up, we have Nimbus, or NB.1.8.1 technically.
Right.
This is right now the dominant strain here in the U.S. It's making up roughly, 40 to 43% of COVID cases?
Yeah, that's the figure. About 43%. So yeah, dominant.
And the WHO, the World Health Organization, they've classified it as a variant under monitoring.
Which means they're watching it closely.
Exactly. Watching it because it's highly transmissible, right? And it has that potential public health impact, even if it's not yet a variant of concern because of severity.
Precisely. High transmissibility is the key feature they're tracking there.
So, okay, Nimbus has this really painful sounding razor blade throat associated with it. But the crucial point you're saying is that transmissibility isn't directly linked to how severe the illness is.
That's a critical distinction, yeah.
So how does that change how we should, approach these new variants?
Well, it's a really important insight because it means that while the virus is still evolving to be very infectious, its impact on how sick someone gets isn't necessarily getting worse.
Okay.
So for us, this kind of shifts the focus. It moves away from maybe fearing a worse disease to really understanding how it spreads and how we prevent that spread.
Yeah.
It allows us to stay vigilant, definitely, but also keep a sort of calmer perspective.
That's a really vital perspective to have right now.
Okay.
And then there's Stratus, or XFG.
Right, XFG.
This is another one that's gaining attention, not just here, but globally, because it also spreads quickly. Though our sources indicate it mostly presents with pretty mild, traditional COVID symptoms. Scientists are still looking into whether it has any really unique signs.
Exactly. And it just highlights this need for ongoing surveillance for really all these variants. We're always trying to stay aware of what's circulating, looking for any shifts in how they behave or the impact they have.
Yeah, that vigilance seems key, especially when we talk about what these variants actually feel like. So for those of you listening and wondering about symptoms right now, what are we actually seeing, on the ground?
Well, what stood out in the reports was, interestingly, maybe the lack of dramatic shifts in the common symptoms.
Ah, okay.
There hasn't been a huge change from the earlier waves of COVID, although it is worth noting some strains, like Nimbus we mentioned, do seem to hit the upper respiratory tract maybe a bit more noticeably.
Got it. So the common symptom list, it still includes things like a sore throat, which, again, can be really intense with Nimbus.
That's the one getting the attention.
Fever or chills. A cough could be dry or productive. Congestion or a runny nose. Fatigue, muscle or body aches, headaches.
Pretty standard respiratory virus symptoms, really.
Yeah. And we're still seeing loss of taste or smell in some cases, and for some variants, maybe some mild GI upset, like nausea, vomiting, diarrhea.
Yes, that's still being reported with some variants, though perhaps less commonly the focus.
Yep. Okay. Now, let's really put a spotlight back on that razor blade throat. I mean, the description, swallowing shattered glass.
It's incredibly vivid, isn't it?
It really is. It almost makes you wince just hearing it. Has this particular intensity changed how people are maybe thinking about their symptoms?
It's certainly drawn a lot of attention, yeah.
Yeah.
But here's where the nuance is really key. The razor blade throat might grab headlines, but the real takeaway, according to experts from places like Johns Hopkins and Tufts,
right,
is that even the most dramatic symptoms aren't like definitive proof of one specific variant. While the intensity of a sore throat can vary a lot, that symptom alone can't reliably tell you, Oh, this is NB1.1.1.
Okay, that distinction is super important. The razor blade throat isn't definitive. But given how much is being talked about, how do we, stop people from just self-diagnosing based on that one really bad symptom? How do we make sure they actually get tested properly?
Yeah, that's the challenge. It really comes down to consistent messaging.
Mm.
An unusually painful throat, it absolutely should prompt testing. But not just for COVID.
Right.
Test for other common things too, like strep throat. Knowing what you're actually dealing with is always, always the first step to getting the right care, no matter how intense one single symptom feels.
Okay, so the takeaway for you listening is clear. If you get a really, really painful throat, don't just assume. Get tested for the common culprits. That makes total sense. All right, let's widen our lens a bit now. What does all this mean in the bigger picture, the broader U.S. context, say, as of summer 2025? Well, the good news, according to the data as of July 11th, 2025, is that case counts, hospitalizations, and even those wastewater signals.
Yeah, the sewage surveillance.
Exactly. Those early community indicators we track by checking sewage for the virus, they all remain pretty low nationally right now.
Which is encouraging. And if we connect this to the bigger picture, it highlights that while things are relatively stable now, we can and probably should expect some seasonal upticks.
Ah, okay. So stability now, but expect bumps.
Yeah, history kind of shows us that. Summertime transmission patterns, especially, after holidays when people gather more indoors or travel.
Right, like the 4th of July recently.
Exactly. That can lead to small surges. It's almost like clockwork sometimes, isn't it?
It really feels like it sometimes. And that's why that continued surveillance, watching variants like Nimbus and Stratus, stays so important even when things seem quiet.
Absolutely. It's all about trying to stay ahead of the curve or at least keep pace with it.
Okay, now let's pivot. Let's talk about what you can actually do. The preventative steps, the advice that still matters, really regardless of which variant is circulating.
Right. The practical stuff.
Exactly. First, vaccination and boosters. The updated vaccines, they still protect against the severe outcomes, right? And having good population immunity is still key for keeping hospitalizations down.
Crucial. Still the #1 tool for preventing serious illness.
Then there are the antiviral treatments, things like Paxlovid, remdesivir. They're still effective.
Yes, very effective, especially, and this is key, when they're started early, after symptoms begin, particularly for people who are at higher risk of severe disease.
So early action is critical there.
Oh.
Okay. And finally, the basic precautions. The things we've all learned over the last few years. Still recommended. Masking in crowded indoor spaces, washing hands.
Still good advice. Consistent hand hygiene, staying home if you feel sick. These basics still make a difference in reducing transmission of all sorts of respiratory viruses, not just COVID.
Makes sense. And if you do develop symptoms, especially that really painful sore throat or a fever, the advice is still test. Test for COVID, test for flu, test for strep.
Yes, test to know what you have.
And seek treatment if you're in one of those vulnerable groups or if your symptoms just feel like they're getting worse.
Absolutely. Don't wait if things feel severe or if you have underlying conditions.
Okay. But what about the lingering effects, the long haul, long COVID? That's still a concern for a lot of people.
It is, and rightly so.
Our sources are saying that, up to 10 to 30% of people who weren't hospitalized might still experience prolonged symptoms?
That's the estimated range, yes. For non-hospitalized cases, a significant minority can develop long COVID.
And the symptoms can be really wide-ranging. Fatigue, brain fog, chest pain, lots more.
The whole spectrum of issues, unfortunately.
But here's something really significant I saw in the notes. Early intervention, getting those antivirals or other medical care quickly, can actually lower the risk of developing long COVID by about 40%.
That's a really encouraging finding, yes. Acting quickly if you get infected doesn't just help with the initial illness.
Right.
It seems to potentially reduce the odds of those lingering problems by a substantial amount, around that 40% mark. And this really raises an important question for all of us, doesn't it? What's the real value in taking action early? If symptoms do stick around, say beyond 4 weeks after you first got sick, that's the point to definitely consult your doctor. Talk about possible management strategies. Being proactive about your health can make a huge difference in either preventing long COVID or managing it better if it does develop.
That's really powerful advice. Be proactive. Okay, so as we wrap up this exploration, let's just quickly bring it all together. We've seen these circulating variants like Nimbus and Stratus, but the overall picture, for most people, COVID seems to remain a milder illness, though we should still expect those seasonal bumps.
Right, expect some fluctuations.
We've unpacked the key symptoms,
Yeah.
that intense sore throat, the razor blade feeling, but also cough, fever, fatigue, congestion, maybe some GI issues.
Usual suspects, with maybe a spotlight on that throat pain.
And maybe most importantly, your best defense is still that multi-layered approach. Prevention, vaccination, timely testing not just for COVID, but flu and strep too, and getting treatment early, especially if you're high risk.
That sums it up well.
So as we finish up this session, here's something maybe to think about. In this world where health info just keeps shifting and evolving, how do we find that balance? How do we best balance being vigilant, staying informed, with actually, living our lives?
That's a great question. And maybe also think about this ongoing dance, this interplay between how the virus changes and how our collective immunity responds. It's constantly shaping public health. And consider what role you play in just understanding that evolving picture, not just passively watching, but being, actively informed.
Great points. Well, thank you for joining us on this deep dive today. Stay curious, everyone, stay informed, and we'll catch you next time.